Hi, my name is Autumn Irwin, and I will be speaking with you today about your breathing. I know you've had some problems with it lately, and so I would like to discuss your diagnosis. You have chronic obstructive pulmonary disease, or better known as COPD. It's a progressive lung disease that blocks the flow of your air and makes it harder for you to breathe. I am sorry for this bad news. It is fairly common. Over 30 million Americans have it. It is most caused by the long-term exposure to irritating gases or particulate matter, and most often from cigarette smoke. Your age plus your smoking history put you at a higher risk for this disease. You might also be more genetically disposed to it. I know this is a lot to process, so let's talk about your condition. I'd like you to have all of the information. Some of the common symptoms are increased breathlessness, frequent and chronic coughing, which can be dry, or you could be coughing up some phlegm or mucus. Also, wheezing and tightness in the chest. I see in your chart that you're experiencing most of these symptoms. Generally speaking, you might experience some fatigue, which is when you feel extremely tired or exhausted, and you might also have trouble exercising. This is due to the fatigue and just the difficulty breathing. COPD is manageable though. There are different treatments out there, but I would like to start you on a bronchodilator. To explain how this works, let me begin by explaining how you breathe and how COPD affects that breathing. It is a little complicated, so feel free to ask questions whenever you are confused. Within the lungs, you have bronchial tubes, which branch many times into thousands of smaller, thinner tubes called bronchioles. These tubes end in a bunch of tiny round air sacs called alveoli. Small blood vessels called capillaries run along the walls of these air sacs. When the air you breathe in reaches the air sacs, oxygen passes through the air sac walls into the blood in the capillaries. At the same time, carbon dioxide moves from the capillaries into the air sacs. This process is called gas exchange, and it brings in oxygen for the body to use and removes the carbon dioxide. The airways and air sacs are elastic and stretchy. When you breathe in, the air sac fills up with air like a small balloon. When you breathe out, the air sacs deflate and the air goes out. In COPD, less air flows in and out of the airways because of many reasons. For one, the airways and air sacs lose their elastic quality. Also, the walls between many of the air sacs are destroyed. And the walls of the airways become thick and inflamed. They also make more mucus than usual and can become clogged. So basically, your lungs aren't able to expand to breathe, and so you're not getting in enough oxygen. And this is what's causing the difficulty breathing and the chest pain. To help you breathe with these affected air sacs, you have a bronchodilator in the form of an inhaler that you can carry around with you. You breathe it in, and it relaxes the muscles around your airways. This helps open the airways, which helps relieve coughing and shortness of breath, and it can just generally make breathing easier. Your COPD is pretty severe, so I'm going to prescribe you a short-acting bronchodilator that you should use before activities or trying to exercise. And then I'm also going to prescribe a long-acting bronchodilator that you can use every day, a lot of times at the beginning of the day, just to help with your symptoms and help you expand those air sacs to get in more oxygen. Another really important part of staying healthy and breathing better is quitting smoking. I know that it's really hard to do so. Nicotine is very addicting, so I just want to give you some brochures about quitting that can give you some tips and support groups. It can also recommend some medications such as nicotine gum and a nicotine patch to help you ease off and in the transition of quitting smoking. Another thing, let me be clear on what we want this treatment to do. Unfortunately, there is no cure for COPD. Instead, we are focusing on relieving your symptoms. slowing the progress of the disease, and keeping you active, just overall improving your health. I really hope that you take my advice into consideration and don't be afraid to reach out to me with any questions or concerns. I'll be available if you need me. So yes, you're free to go now. Just keep in contact with me and whatever you need.